Minimally invasive procedures in the treatment of sleep-related breathing disorders are becoming more and more accepted. Here you see the application of bipolar radiofrequency-induced thermotherapy, RFITT, to the base of the tongue to treat habitual snoring and mild obstructive sleep apnea. Prior to any treatment, it is necessary to arrive at a proper diagnosis about type and severity of the sleep-related breathing disorder. The treatment of the tongue base with bipolar RFITT can be performed using local anesthesia. However, based on the surgeon's judgment and in cases involving multi-level treatments, it may be advisable to employ general anesthesia. A topical anesthetic, for instance a 20% benzocaine gel, is applied to the rear of the tongue, followed by the injection of 2 to 3 milliliters each of a 2% lidocaine solution at 3 points in the area of the circumvallate papillae. The Celon ProSleep Plus applicator is used to treat the base of the tongue. The size of the resulting coagulation depends on the power setting of the power control unit. For the treatment of the tongue base, we recommend a power setting of 7 watts. Depending on the size of the tongue base, 6 to 8 punctures in the area of the circumvallate papillae are recommended. Insert the tip of the applicator into the tongue muscle until the applicator's insulation tube is touching the tissue. Once the applicator has been positioned, the power supply is activated by pressing the foot switch. The status of the coagulation is monitored via the acoustic signal. An increasing pitch of the signal indicates the progress of coagulation and the increasing tissue impedance. A high-pitched intermittent signal indicates the completion of the coagulation process. The power output is reduced automatically so that overdose effects are excluded. The applications require only a few seconds per lesion. The entire procedure lasts for only a few minutes. Individual coagulation zones should be a distance of approximately 1 centimeter apart. In this way, a seam of untreated tissue remains between them. Volume reduction, accompanied by a tightening of the tissue, is apparent within the next 6 to 8 weeks as a result of scarring and the body's resorption process. Post-operative analgesic therapy with ibuprofen or diclofenac is recommended should this prove necessary. Beyond this, post-operative antibiotic prophylaxis is recommended using cephalosporin or clindamycin tablets, for example, to avoid abscess formation. Due to possible post-operative swelling at the tongue base, the patient should be monitored for a period of around 6 to 8 hours following the treatment. It may be advisable to carry out further treatments at intervals of around 6 to 8 weeks in order to achieve an optimal result. We wish you much success using the Celon method. For more information, please contact Celon directly or visit our website at www.celon.com.